Thank you all for being here today. And we'll get started here with coffee with the mayor. I appreciate you being here as always. And we have a few guests today. I think Dr. Dan Kieser is going to be the first one to speak.
Can you speak up, please?
Sure. Dr. Dan from the school district will be the first one to speak on what's happening in the school district, and we'll turn up the volume a little bit. And you can come on up, I'll get you a microphone. Is that better?
Yeah.
Yes. You want to be here or here?
I can take that.
All right, and then you got this guy for your slides.
All right. All right. Well, happy Friday, everyone. Welcome. My name is Dan Kieser, in my fourth year as the district administrator here in the school district, and happy to have these opportunities to come and share a little bit of what's happening in the school district. Just had an opportunity to, as we're getting ready to get started, talk a little bit about what's happening with our school district. We had our district report cards come out this month. And some of you may or may not know the school report cards started many years ago. And it's really the state's effort to help the communities kind of understand what's happening in the school district. So they came up with the report card, not unlike the report cards we had when we were students. And it measures a whole bunch of different areas. And it's graded on a 0 to 100 scale. As a district, we are exceeding expectations that the state puts in front of us. We have a score of 71.1, which is an increase. And we saw increases across all of our individual schools. We have schools that meets expectations all the way up to exceeding expectations across all 5 campuses and as a district. For ourselves, as important as this is at the state level, we look at reading and math specifically. We have 3 goals at the board level that we've set that focus even more a fine grain of sand than what the school report card does. We want to increase the proficiency of our students at all grade levels in reading and mathematics. We also, as our 3rd goal, want to create a sense of belonging, because we know that when staff and students feel like they belong in the community, they will do their best work. So just want to let you know, these are on our school websites, so if you want to take a look at them, they're about 11 pages each, so be prepared. And it has a lot of data. But every year, every school district across the state gets these, and we've been doing some really great things over the past 3 years, so I wanted to highlight that. Also wanted to highlight, we just had Veterans Day, and to all of our veterans, our hearts and thanks go out to each and every one of you. Our schools had different activities and events. We had an assembly at River Bluff to end the day. We started the day at our elementaries and at our high school, welcoming veterans and significant others to talk about their experiences and just to share what it means to be a veteran, why did they choose to serve, and then some of the takeaways and be able to answer questions. It was a point of pride because many times children and grandchildren in the schools asked their parents and grandparents to come and speak, so it was great. And if you have a chance, our middle school band learned all of the songs for each of the 6 armed forces, and they played them as a medley to close out. That was a lot. And you can see some of the pictures that we have here.
And Dan, we had 3rd graders from Fox come and sing for us.
Awesome.
They were wonderful.
So we started them young in the arts, which is great. We also had for our fall activities, we just wrapped up fall sports. Winter sports are kicking off, so last night we had our first girls basketball game. We have a lot of activities on our calendar. So if you have not seen our website, we do have kind of a calendar. You'll see these around town. I have like our last 5, so don't all rush to the table, but we do have some around, and I do believe we have some here at the senior center. But they have a lot of our district events. The most prized thing coming up right now is we've got our Magical Singers. Those tickets went on sale this week, so go online so that you can get your dinners. It's December 13th and 14th. We'll have them at Victorian Holidays on December 6th. We also have our winter music concerts coming up in a couple of weeks here, so please, if you didn't have a chance to hear our Fox singers here or at our middle school band, you'll have an opportunity to hear choir band and orchestra in a couple of weeks. And then certainly just want to thank the support of our business partners. Talking about everything that's been going on in the government lately. We have our elected officials coming in February. This will be the 4th year that we've invited our elected officials. We have local, county, state, and federal elected officials that come to the school district. This year we're going to be showcasing our high school and our transition program and our community business partners. So we're really looking forward to sharing our story, because what happens in the school district is a microcosm of what our community does across our state. So with that, I will close out and open up for any questions.
I actually have a question for you. So have the standards changed when you guys are rated on the report cards since COVID?
Not since COVID. Our standards get changed on a regular basis with DPI. So in 2020, they updated the reading standards. In 2021, they did math. Last year, they did social studies. So they just have a regular cadence where they take a look at the standards. Those standards then play into the report card, but the report card itself has not substantively changed. It still looks at reading and math specifically, which haven't changed.
So have those scores, I don't know, not for the school, but in general, have those scores gone down because of that period that COVID had? Because people stepped back so far, so did they?
Achievement around those standards did dip over the pandemic, but because we've been focused hyper-specific on those two skills, we've seen a growth. So I would be over-promising that we completely recovered from the pandemic here, but we have largely exceeded the scores that we were achieving before the pandemic across our district. We still have pockets of students who come with challenges and needs and supports, and so our focus as a district has been focusing on the supports for small groups of students who are showing needs for those supports, if that makes sense.
Mm-hmm. Continuing with the scores of the different schools, the middle school seemed to score the worst, and I was looking at the scores for other school districts in the area, and in general, it wasn't always the case, but for most school districts, it was always the middle school was the lowest. And I was wondering if anybody is looking into that there seems to be something going on there.
How many people have middle school children or grandchildren? The best analogy I've heard to describe a middle schooler is a hurricane wrapped in a tornado.
Yes.
That perfectly describes what is going on in 12 to 14-year-old body. They are trying to develop their own identity. They try on different identities by the day, sometimes multiple identities in a day, which sometimes pushes against You know, they love you one minute, they hate your guts the next minute. My 19-year-old still doesn't like to talk. I keep telling him, when you turn 20, you'll return back to us. Where am I going? It's like your body will return, your all that will return. Yes, it is.
I don't disagree with
Yeah.
that, but there seems to be the standards. If everybody scores low
Yeah.
in the standards in that area, then there's something wrong with the standards.
Standards, and it's also support. So that's why we focus, that's why specifically here in the school district we have belonging, because belonging is getting at that component of it. Sometimes we have to modify what we're trying to do academically because the student's brain is just not in a space to do that. So we are looking at the whole child and not just the academics. But you're not wrong. When you look across the district, the grade bands, the grades, ages from 12 to 14. Doesn't matter if you're a K-8 school district, a K-12 school district, or like us, elementary to 5th grade, middle school, 6, 7, and 8, and high school 9, 12. It will always be those grades, and it's all of it. So we haven't figured it out. We're choosing to try to address it with our belonging goal and see if we figure it out for ourselves. But lots of other districts are trying different methodologies, including all these different grade level configurations to try to address those standards. It's not the answer that, it's a much longer answer, but you're right. It's a challenge for us.
Dan, just a reminder for folks, speaking of the sports, the winter sports are starting. Remember, you can get a pass for older adults at our desk. The receptionist can get you the pass, so you don't have to pay to get into sports events here in Stoughton. So that's something that the school provides for us, so we appreciate that.
Thank you for the reminder.
I just wanted to make a compliment about, I was worried about the maintenance building, as you know, and it looks very nice.
Thank you.
And I look at it every day and I'm not, it's okay. Yeah, it's very good. I mean, you got that fence in there too, I really appreciate that.
Yeah, I appreciate you partnering with us and giving us feedback along the way. That's been helpful.
Any other questions for Dr. Dan? All right, well, we'll get the Sarahs up here.
Well, does Chris need to get,
I don't know.
I don't know.
Chris, do you have a timetable today, or? you wanna
I
go?
do not, so
Okay.
I don't have to leave until 11:30, so I can stay for questions.
All right, we'll get the Sarahs up here. I'll advance the slides for you because for some reason. You don't want to talk? Don't be shy.
Talk a little bit.
Okay, we're not shy around here. Just let me know if you want me to advance the slides.
I will.
Okay.
Hello, I think most of you know me, but I'm Sarah Ebert. I am the president here at the chamber. I do have slides because on Tuesday night, I have to give the same presentation to the city council, so this is a good practice.
Okay.
And I'd be less nervous telling you than I'm going to be at city council, so. I talk often about the chamber in whole, and I've mentioned a little bit about visitor services, but today I really want to explain to you what visitor services is. And it is a department underneath the chamber. And so what visitor services does is that we're kind of like the welcome center of Stoughton. And it is our job to advertise Stoughton, to get people from outside to come in. And how that's funded by is that all lodging establishments have a room tax that's tacked on. And if you ever look at your bill, you will see that. So the hotels, Airbnbs, bed and breakfasts, they all charge this. And so the lodging establishments in Stoughton get charged this tax to the, and they give the money to the city. And then in turn, visitor services gets that money, gets a portion of that money. The city gets a little bit and the chamber gets a little bit, but the majority goes to visitor services. And we use that money strictly to do, bring people in to Stoughton. So you may not see it because we don't need to advertise to our Stoughton people because you're already here, but we definitely do a lot. When you see all the ads and things on TV, especially around Setnamai, that comes from visitor services. Setnamai is our largest event that we bring people into Stoughton. So just backing up a little bit, you all, I think, maybe know that back in July, the depot was sold and we moved to City Hall. And we're very grateful. They're a great host. And we all have our spots and we're settled in. Very nice. We have a new tourism coordinator and it's Sarah Slager right here. Sarah is a Stoughtonite. She has lived here many, many years. She's been a very active person in the community. So we're really happy to have her. She has the passion that we need. And her job is strictly, she works on getting people to come into Stoughton for tours. I don't know if you realize, but we do have tour buses come in. It's a typical, and I'll get into this, I'm not looking at this at all. I'm not going in the right order, but anyway, it's a typical tour would often be a Norwegian tour where they go to the Sons of Norway, they go to Livrisa, they go to the Opera House. But now we're really trying to expand it, and that is Sarah's job to get people to come in. If we can get people to come in and see our town, then they may come back, they may stay overnight. And then when you come into the chamber, and if people are visiting for the day, or even have, if you have family members that are coming for the holidays, and you do what you do, but they're gonna be with you for some days, and it's like, well, what am I gonna do with them? You can come in and say, what's new in Stoughton? What can we do over this period of time? And Sarah would be there to help you out. We have an actual Visit Stoughton website, so it's different than the chamber website. It's beautiful. You go in there and we have all the restaurants in there. We have all the shops in there. You can sort it any which way. We have a beautiful new calendar that you can see what's going on in Stoughton. That, though, I want to let you know that we don't necessarily keep track of everything that's going on in Stoughton because that would be kind of impossible. So we do leave it up to the people that are holding these events or having things to let us know. They can submit it online and then we will put it up. So it is a beautiful website that will let you know everything that you need to know. All right, if you wouldn't mind going. Just one little example. We had a tour here when I was telling you about our tours and how we're kind of changing them around. We had a group here from Green Bay in October. They started out at the Opera House. In addition to hearing about the story about the Opera House, the Norwegian dancers came and gave a small performance. Then they came to the Sons of Norway, and Nancy O'Donnell did this cute little rose mulling activity on a wood spoon. And then they could eat lunch at the Sons of Norway, and then the Sons of Norway gave them a little demonstration how to make lefse. And then they just had to walk to Livrisa, got a tour of that, and then they were set free for downtown. So, we really work hard to try to give them a fun experience, and they couldn't speak highly enough. So then they come back. So that's just one thing, but we have more than Norwegian culture here. We have parks, we have, outside activities. So again, that is what we're working on to create something that anybody, for all likes in all years. We have, even though that the Visitor Services is a department of the chamber, we have a special commission or a committee that we meet with every other month that talks about, what's coming up, what would benefit them more. We have people like Mark from Livrisa on there, Jeremy from the city with the rec department's on there. Ingrid has McMaster's down here has a store called Spry Whimsy. She's on there representing retail. We have Phil from the city council on there. So we do meet to try to get everybody's input, and so they know what's going on about what's coming up. So that is really important. We have great partnerships. So when I was telling you before, like how is it different from the chamber represents our members. Visitor Services represents Stoughton. So the chamber is a membership-based organization, and that's you know, my biggest part. That's my wheelhouse. I do things that give opportunities to our members to take advantage of. So Visitor Services, again, highlights the whole town. So things that we do, they help us out greatly, like I said, promoting our events that actually bring people from outside of town. I mean, so like Set in a My or Coffee Break, Visitor Services money would not prevent our golf outing, because that's just internal. We've worked with the Stoughton Fair. We've helped promote that. Visitor Services has been a co-sponsor of the fireworks. Catfish Music, and we've highlighted all the musical acts. Taste of Stoughton, we help them out. Art Walk, we help them out. And that, in addition to, you know, just the events, we have some really great partnerships with some local businesses that help us out. Like we have a couple of great businesses that have wonderful getting our photography, our pictures, our marketing. We have one that does aerial shots, you know, has a drone. So those also are really great partnerships. I brought to you guys not that long ago, we created a visitor guide. I was gonna bring some today to show you, but we'll have a new one each year that kind of highlights exactly what's on the website. So if somebody walks in, you can hand it to them. So again, all the restaurants are listed. What do those restaurants offer? All the places you can go outside are listed. All the places you want to go inside are listed. It's really a beautiful piece. Okay, let's see. So, can you go to the next slide, please?
Sure. Quick question, if people want to get involved, what's the best way for them to reach out to volunteer or sponsor or support your events and your activities?
Probably you guys would be the best for volunteering. I will always take money, but typically it doesn't come from individuals, but volunteering. So, you know, for any of our events that we have through, you can always reach out to me. Set in My Button Boost, 2-hour shift. You can talk to everybody in town. You guys volunteer for the Button Boost, so it's a lot of fun, right? I will always plug volunteers. This year, we did something, we had access to 2, okay, this might be kind of creepy, but this is just what it is. We have 2 location intelligent platforms, so they're trackers. So anytime on your phone, you know, you have a location tracker on your watches, on your iPad. So there's companies that can track exactly, not you personally, not Sarah personally, but can track somebody that is, you know, Sarah's age, Sarah's demographic, where she lives. We can see all that. So these are just some highlights, and highlights of downtown. So we can see compared to last year, the traffic that is downtown throughout the months. So January, we were down 18%, but then in March, we were up 5%. April, we were up 5%. May, we're up 9% from last year. And that just goes and highlights that our busiest time, our busiest tour season is in second and third quarter. Second quarter kicking off Set in a My. And then if you scroll down a little bit, and again, this is just highlighting downtown. So the majority of the people that visit downtown are right here from Stoughton. So our Stoughton people are taking advantage of our downtown. Then the next biggest group, they come from Oregon. And then Madison was never that high before. It was more people from Rock County coming up here. But they're now starting to filter down from Madison, which is really, really great. And then it just goes on from there. And when I said, again, they don't tell you exactly, like they don't know that where exactly I am. But the average profile is visitor, they termed it visitors in blue collar suburbs. So they're between 35 and 44 years old. The median income is $55,000. The household with children is 36%. College degree, 32%. And 63% home ownership. Is a little kind of creepy, but it's just out there. But it helps us, because it helps us target, like, who's coming from what. So then what would they want to see? That helps us do our advertising and our marketing. That's not anything different than I'm sure the hospital gets some of that kind of same information, but they use it in a different way. And that's, you know, where they put all their clinics, where are they coming, where, you know, what is the gap? We're no different. So really getting ahead, using the technology we have to get as many people to Stoughton.
Yeah.
All right, let's go to the next one, please.
Any questions about that?
So this is for tourism from Wisconsin, from Travel Wisconsin. You can see the highest areas, the highest months that people come and they travel. And then below, it's really hard to see, but that is specifically Stoughton. And you can, our highest month that people come to Stoughton is in May because of Setnamai. And then the second highest is July because of the fair. So, yeah. Okay, you can go to the next one, please. And then again, for our priorities for next year is continuing, it's called, the fancy word is targeted marketing campaign. Again, using those numbers, where people are coming from, what they're looking for, and then us figuring out the best way to get more people based on that information. And then also, Sarah is gonna really dive in, like I said, creating other tours, being creative, how to reach out to people, how to let people know about Stoughton. So, and every year it changes. We didn't have this ability last year. You know, we definitely didn't. Every year it just changes, and we try to change with it, try to stay flexible, so we can offer what we can offer. Anybody have any questions about that? All right, I really have to pare it down for city council, so thank you for bearing with me. All right, I'm all done.
Okay, and now get Chris set up here next. Just take me a moment.
Oh, one little fun thing, I forgot, I should have left this, you guys would find interesting. So next summer, in July 15th through the 19th, we are having a tour coming here, and it's a Telegate Leg Steven, and it's 250 people. So what it, I had to have Marg help me out with this. So a Steven is the Norwegian word for a meeting. A leg is a group of people, so it's the Telemark region. And it's not people from Telemark, but the Telemark region group is hosting the leg, the Steven, for next year. So 250 people are gonna come and stay in Stoughton from the 15th to the 19th. Yeah. It is a long time. Don't ask me a lot more questions about what that all means, because I literally had to look it up and kind of research it. It is cool.
What month is that?
What?
July?
July.
Oh, okay. You know what I was gonna ask you though? That's great for all the neighboring towns, but do you have any tracker for neighboring states? Like Illinois, Michigan, Minnesota?
I'm hoping to get that more information as I get involved. I had a cold call December 6th. I have a group of a bus of 40 people coming from Minnesota. So yeah, so hopefully, you know, trying to keep track of that for sure.
Yeah.
Yeah. The Opera House has a database as well, so hopefully there's some opportunity there for some collaboration. Like last night, there were people from out of state there that came for the show, and that happens quite often, where they'll follow bands, or maybe a band will only be in a certain area, so they go to the show while they can. So we're seeing a lot of that too. People are traveling for the experience, not just for the music, but for the whole experience, which is good for us because we want them to stay overnight.
And we are able to get a broader, this was just my example. I can go as broad as taking a look at Man Park, or I can go as small as taking a look at the SWAC. So to get those numbers, this was just an example.
Great, thanks.
We also have your data. But by law, we cannot share it. It's called HIPAA. and there's only certain legal instances in which we can share your data. So I know sometimes it's thought that hospitals sell data. We do not. We cannot. That's a federal offense, and that would actually close the hospital pretty quickly. Any other questions for Sarah before we get started? Sarah and Sarah, I mean, excuse me.
Make it easy, thank you. Yeah.
Well, good morning, everybody, and thank you for the privilege of being here. My name is Chris Brabant, and I am grateful to be the CEO and president of Stoughton Health and the Stoughton Health Association. And so, great to be here on November 25th, which is, oh my goodness, next week already on Tuesday will mark my 1-year anniversary of being here in town. So it's gone really quickly for me. So very briefly, my background, I'm from northeastern Wisconsin, Green Bay. Grew up in the shadow of Lambeau, if you will. And I do have a healthcare background in that I'm also a clinician, and I still am. I'm what's called a perfusionist. So I operate heart-lung machines for heart surgery, and actually I still work in heart surgery. And immediately following this dinner, I'm having lunch with Dan DeGroot, so still keep in touch with both Dan DeGroot, who's my predecessor, and also Terry Brenny, who I also, not that I'm dropping names, but I am. And, but they offer great advice and have great historical perspective as well. And if any of you know them, they're extremely knowledgeable in the things that they do. So a wonderful relationship that they built with them. So anyway, I also have a clinical perspective in addition to that business perspective. So what is Stoughton Hospital? Well, the mission of Stoughton Health, I'm not going to read each and every word for you, but for that mission statement, the last 3 words are the most important: exceptional personalized service. We try to treat each patient and each patient's family, friends, whoever accompany them with exceptional personalized service. We try to do that for everyone and make that individualized. You're not just a number, you're not room 315. You're not that MRI patient, you are a name and a face, and we really, really try hard to make sure that that is a personalized experience and that we know you, the person, not you, the patient medical record number. So try very hard to do that. And our vision is to change with the changing needs of the community. That's the vision. Now, I would say I would much prefer the word evolve. Change means something wrong is going on, right? There's not that emotional connection, whereas evolution is how we evolve. It's how healthcare is evolving. It's all how all of you are evolving. Who looks exactly the same as they did 20 years ago when they looked in the mirror? I can tell you all this pretty looked a lot different 20 years ago. It's kind of a frightening transformation for me as far as I'm concerned. But we need to evolve as healthcare evolves, as technology evolves. Bringing in, we have an orthopedic robot now as a tool for the orthopedic surgeons to actually use precise robotics to do joint replacements, to do the surgical procedures that take care of you. That's our obligation to the community, to evolve as the technology evolves and as your needs evolve, to actually become less invasive, and so that we can spend less time doing a better job doing our best to make you well. Now, sometimes we don't always do a good job of that, and we'll get into that in a moment as to what I mean by that. But just wanted to acknowledge that we'd love to be perfect, but a human system run by human beings, nothing is ever perfect when we're involved, right? Just saying. And then our values of how we do these things, how we, attitude, accountability means how we present ourselves, that teamwork piece. How many of you who've ever gone to the doctor have only talked to one single person that works at that hospital or clinic? Never. From valets to registrars to the person taking care of you to the nurse to the CNA, you talk to the whole team, right? And that takes that team effect. And I'm not going to be this long on each slide, I promise, or we'll be here till 1 o'clock in the afternoon. But my point to that is one of the main tenets that I brought to the organization is that the very first person that any of us has to take care of first is who? It's not the patient. It's themselves. If you can't be your whole self, whatever that looks like for any one of us outside of work, how can you bring your whole self to work to take care of your team, to take care of all of you in the very best way we possibly can, right? So if you think about that, that's kind of the philosophy that we bring to our focus on taking care of folks such as yourselves. So we have all these different things that we're bringing on or have started. There's a program out there called Senior Life Solutions. And what that is, it's an outpatient, meaning you go in and you leave the same day, essentially therapy session. We are all going through changes in life regardless of age. This is a program specifically focused on folks who are 65 and older. It's an adjunct or in addition to our Jerry psychiatric inpatient program in which we take care of folks in that patient grouping or cohort, if you will. Now this group will have counselors, they'll be responsible and have access to a psychiatrist, and will be able to work with either individuals or groups to help folks as they transition from one stage of life to the next. And so hopefully this will certainly bring, not hopefully, we know it will certainly bring an added service, if you will, to the community that is specifically focused on those folks who are 65 years and older. This is set to start December 21st. So very excited about that program. And then the new outpatient center, that new building that we opened back in April. And you go, why, okay, bricks and mortar, why are you building more stuff? That's expensive. That's $25 million expensive. Well, remember that evolution thing I told you about earlier on? We're committed to having to do that because of the changing needs of not only the healthcare professionals taking care of patients, but the evolving needs of the patients themselves and how we are going to adjust to the different patient populations or to the different populations that Sarah just spoke about. And so this outpatient center kind of brings everything together and doing what we specialize in. We're what's called a small suburban critical access hospital. And you're like, well, so what does that mean? That means that we are a 35-bed hospital, okay? And that critical access is a designation by the government or CMS, the Centers of Medicaid and Medicare. And what that means is they understand that our mission is to take care of folks in that rural setting. 61 million people live and work in the rural setting, right? Over 20% of healthcare in this country is delivered in that rural setting. The only way a hospital can make a margin enough to keep the lights on and to buy this expensive equipment like robots that I was telling you about is through volume, meaning lots and lots of patients cycle through, right? Well, at a critical access hospital, we don't have as many patients. So therein lies the issue of the government thing. By designating us as a certain type of hospital, they will actually pay us more for the same service that, say, is offered by St. Mary's or UW or something like that. It's recognizing that we don't have as many people coming through. And you might say, oh, you don't have as many people coming through. Well, then you don't have to do things as well as St. Mary's, or you don't have to do things as well as UW or Freighter Health or Children's Wisconsin or American Family Children's or anybody else. That couldn't be more inaccurate. We have what's called national benchmarks. We report our quality data, our patient satisfaction data. All of that data gets reported to a central national database, and we are benchmarked, meaning we have to do exactly as well or better than SSM St. Mary's Madison, than UW Health, than Merida, than all the big hospitals out there. All the small hospitals have to provide that same level of service or better. We strive for that, always do better and better. So, because I've heard that from folks before, well, you know, I don't know that I want to go there, you know, they don't have to do as good a job. That couldn't be further from the truth. And we are held accountable, just like all the other hospitals are, by the government, by everyone, you know, by all of the accrediting bodies, and we have to go through that same process. So, I just wanted to share that with you. So all of these things we offer. And so these are the orthopedic specialists that we have. Dr. Rottle, who's been here a while. Dr. Henningsen, who is the new orthopedic surgeon, and Dr. Lind, who's a podiatric or foot surgeon, takes care of your feet. How can you get around if you don't have good feet, right? And your feet take care of your back take care of your feet, so wear comfortable shoes. Just saying, okay? And so bringing, as I tell folks, we can do anything, but we can't do everything. So what we are going to do, we're going to do really, really well, because that's our commitment to the community. That's what we're beholden to do. That's what the accreditors say we have to do. And why wouldn't we? That's the morally correct thing to do. So all the doctors we have, all the trained personnel that we have, all trained in these large academic hospitals, all trained in the large community hospitals. And by the way, did you know that we are also an academic medical center? We train, not officially by government designation, but we train surgical techs. We train certified nurse anesthetists. We train x-ray technicians. We train lab technicians, nurses. We train a lot of different folks also. And what's the one thing that makes you better at what you do? Teaching somebody how to do it. That's one of the reasons we do it. The other one's for retention, because as we know, healthcare workers are really hard to find. So Dr. Henningsen, who just joined us, that's the robot I spoke of that we have. Okay, and that makes for a more precise surgical incision. It actually docks to or marries with, if you will, complex x-rays. So you use the robot and the x-ray to go precisely where you're going to go for that surgical procedure. You're not eyeballing it anymore like regular surgery. And so that offers certain advantages to smaller incisions. It offers certain advantages to getting you out of the hospital sooner, for having a longer lasting repair. And again, our commitment to the community, and that's how new doctors are being trained these days, are with these robotic devices. Dr. Sarah Pergandy, general surgeon. So right now she's here helping us out on what's called a locums basis or a part-time basis, but she's seriously thinking of joining the community. It brings many skill, a wide-ranging skill set with her, including all general surgical procedures, colonoscopies, all of these other things, diagnostic things that we need. And guess what she's going to need in order to stay here? A robot. Because, what's that?
I thought you were going to say patience.
Well, patients too, yes, they're starting, and the word's getting out. Yeah, she's an outstanding surgeon, and this is the other commitment we have to you. We're not going to hire anybody who doesn't have a reputation of being really good. We'd rather pass and not offer the service than hire somebody who, does the best they can, but may not necessarily do well. And you're going, well, how do you know about that? Well, it's those same quality metrics I just told you about. They're also a matter of semi-public consumption. Okay? So there's a whole process for determining who's good at what they do and things like that. And then cardiology, new cardiology services. As we get older, all of us require cardiovascular care of some sort. So bring in a cardiology group, and Dr. Krager and Dr. Shriram. So Dr. Shriram is actually starting on Tuesday. Dr. Krager has been here for a little while now, and in bringing cardiology services, so you don't have to go into the big city. You don't have to go to the UWs of the world and the Meriters or the SSMs, St. Mary's of the world, to get great cardiovascular care. Now here's the catch though. What we also do, remember the thing I said about we can do anything but we can't do everything? They do all of the outpatient diagnostic things. They have the appointment with you. But if you need a procedure in the cath lab, that thing where they run a wire up your leg and into your heart. Who's had well, no, that's HIPAA violation, but some of us in this room have had cardiac procedures. Some of you have had open heart surgery, some of you have had heart caths, they'll go up a blood vessel. But, if you look at cardiovascular care, which is what I do clinically, the evolution of that has been amazing. You can now get a new heart valve. It's called the transcatheter aortic valve, or TAVR. Well, you see, you know what that is.
Yeah, I can't have one, but yeah.
They said you can't have one?
Not a good candidate.
Okay, and there's many reasons for that I'm sure they explained to you, at least I hope they did.
Oh, yeah, I have 3 cardiologists, Mayo Clinic, UW, and SSM Health.
Oh, dang, girl, yeah, they're all paying attention to you. Yeah.
Another one.
But anyway, yeah, you could have another one here, but no, it's, but you can get a new heart valve in about a half an hour is the procedure, the length of the procedure. And then you're in the hospital for the day and you leave that afternoon or usually the next morning. Okay, whereas with that kind of procedure, and that's now the standard of care for those that are applicable. But, and instead of being in the hospital 8 to 10 days and having a sternotomy incision and all those other things. So anyway, bringing that cardiology service to you. But what they'll also do is if you need a higher level of care, if you need to see, have to have a heart cath procedure or heart surgery or something like that, we facilitate that one-stop shop to call our SSM partners to say, hey, Mr. or Mrs. Smith needs to come into the hospital, and they make all the arrangements for you. So to facilitate that transition of care also. And then to have you come back to us for your post-procedural care, when applicable. So. And then of course the Neurospine Center of Wisconsin, pain management. Who hasn't had a sore back in this room? So what these guys do, Neurospine, we partnered with the Neurospine Center of Wisconsin. They're based out of Appleton. However, Dr. Greenberg's right here in the Madison area. Wanted to open up a clinic. So right here at Stoughton, we bring this service to you so you can make a phone call and get on their schedule. We're going to have that, it'll eventually be 5 days a week, sooner than later, for those pain management services, whether it's in your joints or your spine. And if you try to get into the Madison market right now, you're looking at a 30 to 60 day wait as a new patient. Right now, here, you're just having to wait days. So we partnered with them, and Dr. Greenberg is excellent. If you look him up online, he's also a published concert pianist. So who knew that? And the train is coming. So anyway, again, a new service that they've started now, we're bringing to Stoughton Health also. So, and to call, when you look at it, oh, that's a 920 number. Well, in fact, it is. We have a partnership with them. They rent space from us, and then you can see them here at the new outpatient center, okay? And so again, providing great, high-quality service for the community. And then, of course, we continue to grow. Mostly in the Jerry Psych unit, but in other areas as well. Our catchment area, or our service area, is about 57,000 people. Think about the state of Wisconsin and the population. It's changing. However, the population growth is relatively flat, although we have more in-migration to the state of Wisconsin than out-migration. So we are slowly growing, but in our demographic service area, Madison, we have a lot of growth in the Madison City Center area, and not so much in the rural areas. So that's okay. We adjusted that using some of the same demographic data that Sarah uses to try to bring those services to the community. And so there's that piece of information, and then there's just other information about, you know, emergency services, our urgent cares, rehabilitation. And that's the other thing with our emergency room as well. There's lots of things we can do to take care of you. But when we can't, we can quickly arrange transport to get you to that higher level of care. If you're having a heart attack, or if you're having a stroke or something like that, we can treat that in the moment. But we don't have a cath lab, if you will, or those procedural rooms. I mean, that's what the larger places are for. And you might say, well, why is that? Well, and we can say because they do a higher volume. They take care of, they do more of those same types of procedures. And there's reams of data out there that demonstrates the more you do a certain type of procedure, the safer it is for you to do it. That's why those high-level procedures are done in the larger urban centers, for that very reason.
Chris, if I could,
Please.
I just want to interject. He's mentioned the Jerry Psych unit a couple times.
Oh, yes.
It's not a fun place to think about, but from our perspective as case managers and trying to help families through things, it's such an important piece, and it's only 2 Jerry Psych units in the whole state. So it's something to be very proud of, and it's so important for our community and for the whole state, for that matter, that when it's needed, that a family has a place that can get some answers, and it's such an impressive thing.
Oh, you're very kind. Thank you. Yeah, I didn't mention that. Yes, it is only 1 of 2 in the entire state, and we're committed to it. You know, it's interesting with behavioral health being, you know, we all read about behavioral health being such a challenge at all ages, right? We talked about the middle school issues with Dr. Keyser just a few minutes ago. Some of that, a lot of that's rooted in behavioral health challenges, but yet it's not really recognized, and treatment is not really paid for very well by the payers. Now that's evolving, that's getting better, but it's still a struggle. So, but again, to Cindy's point, it's a vital thing for our community. So, and then, of course, we talk a little bit about recruitment and the things that we're doing, and the different things going on in the different services, and all of these different services. But our top priorities are those x-ray people that we talked about, nurses and folks that work in surgery. They're hard to come by. I started out in the world as a surgical tech when I was in the military. I was in the Air Force, and then I'm familiar with Madison because even though I grew up in northeastern Wisconsin, because I was in the Wisconsin Air National Guard at Truex. Way back when the A-10 Warthogs were here. Remember they'd fly over from time to time? So it's just such a cool airplane. So anyway, that's why we love Madison so much. And when this opportunity came along, what a great thing to move back into the Madison area. Specifically Stoughton, even though we do live in Oregon because we couldn't find a house in Stoughton, but sorry about that.
Yeah, they're still looking.
We are still looking, absolutely. No, it's a true story, we are. I'm not saying that to be, for platitudes, it is true. My bride is still looking. So now, I mentioned before, you have a gem right here, and it's not because of me. Right here in the state, we have a lot of people that have worked here for a very long time at the hospital, with a mix of new people as well. And this hospital, they have a tremendous, what attracted me, because when I interviewed for the job, I was interviewing them. If I didn't sense that it was a great organization, quite frankly, I was going to go elsewhere or just continue full-time clinical work. And that was it, And I always tell my kids, remember, when you're being interviewed, you're interviewing your employer. That's the relationship. And that's what I sensed here. And they have won numerous awards and numerous accolades. But don't worry, we do not hurt our wrist by patting ourselves on the back. We have that constant tension, if you will, always doing better the next time. Even when you do a really, really good job, because sometimes we fail. All you have to do is look on social media and you'll see a post of somebody who's upset at us. I was going to say something else, but upset at us because we didn't do them right for whatever reason. We may have missed something, they may have misunderstood, which means we didn't do a good enough job explaining. We may have missed something, remember that human thing, the human conditions, or we may have done something that they didn't understand, or failed to do something they didn't understand. Or they might have shown up early in a disease process or an illness process, and we said, you're fine, and then 2 days later they end up in the emergency department at St. Mary's, Madison, or something like that, because the issue has now surfaced, and now instead of feeling just a little bit wonky, they're feeling terrible. But to that point of that high quality, always that tension there, every time we see something that we haven't done right, and it does happen, we examine it, we review it, we call the patients or the patient family, and we always try to do better. And we recognize and look in the mirror when we have not done well for the patient. So despite all these numerous accolades, and this is just for last year, the fact of the matter is we're on that continual journey to do better and better every single time, every single day, every single patient. I know I've prattled on now for about 20, 25 minutes or so, but that's what you have right here in town just up the road. And if you'd like, I'm happy to entertain any questions you may have or any thoughts, missives, complaints. Well, maybe I shouldn't offer that one. No, I'm just teasing, but just know that you have those folks right here in town all doing their very best to take care of y'all and the community. And what's nice is it's their house, it's our house, we own it, and we welcome folks who come into it, and we do our very best. Yes, ma'am. Ladies first. Yes, ma'am.
Oh, excuse me.
No, that's okay.
Who would I complain to?
Well, you can start with me, if you wish, or you can call the hospital. We have a lady
I'll try
that.
that.
What's that? Pardon?
Doesn't work.
It doesn't work? Well, if you want, they have my contact information, whether you can give me a phone call or what have you, or if you prefer any other form of communication, you can do that. I'm happy to have a conversation. I can't guarantee you that I'll fix it to your satisfaction, but I would do my best.
Well, it's just a complaint. Nothing you could do about it now anyway.
No, but I can keep the next person who has the same experience potentially from going through the same thing you did. That's why we learn from that. So if I go into our hospital and I have a bad experience and I tell somebody about it, it's our responsibility to learn from it so that the next time I go in there with the very same thing, it doesn't happen. That's why I want to hear your complaint.
Okay,
And that's why it matters. Okay?
thank you.
Yes, ma'am. Yes, sir.
Yeah, my question would be, Chris, I don't know if you can answer this or not. This is kind of like hot off the presses as far as Exact Sciences being sold to Abbott.
Oh,
Do you see, that would be affecting the situation with, Stoughton Hospital?
Exact Sciences, I don't know anything about that yet because I have not seen that yet. So, I mean, as far as most lab services, ours are internal or we work with our SSM partners. Could it impact us? Absolutely. I just don't know yet. Definitely though. But no, thank you for your question. Yes, sir.
I just wanted to say something about getting to the hospital. If you live on this side of town, Cooper's Causeway. It's a secret passage.
Thank you for that. It's really secret because I got lost trying to find it.
I don't think there's been any collisions. You gotta be careful.
Not too many. I haven't seen any glass on the ground recently. But yeah, that quasi metal mirror is. Yes, ma'am.
Very contempt.
I just want to go on the opposite side and say I've had the most amazing services at Stoughton Hospital.
Thank you.
I'm a UW Health patient, and so it's a privilege for me to be able to stay home and get some of the testing and other, because they're partners with UW Health.
Yeah.
And they have been wonderful. It's a personal kind of connection.
Oh, that's wonderful. And we do partner with UW Health. I was just emailing back and forth with their COO about a program we call the swing bed program, or the almost home program, where if you've had a procedure in the hospital more than 3 days, rather than say going to a rehab facility or to a nursing home or wherever, you can stay with us, get the therapy you need, be rounded on by a doctor every day, taken care of by the nurses every day, and then instead of going to a rehab facility or something like that, you can just go home.
Much better.
Government-sponsored program. It's why that's the government calls it swing bed, because believe it or not, it's less expensive to have somebody stay at our hospital than it is to send them to one of these other places. And then you can stay closer to your families and what have you. But to that point, that's part of what we do. But yes, we absolutely partner with the larger players because we want to facilitate that process if you need what we call a higher level of care. We don't do heart surgery here. Yet. No, I'm just kidding. Don't start any rumors. We're not going to either.
Yeah.
We're not big enough for that. Any other questions? Yes, ma'am.
It's not a question, it's a statement. I have used the new outpatient facility, but sitting there looking at a dull wall is kind of not fun. Are you putting up any pictures in that hallway?
Absolutely, yes. We've allocated $10,000, I'll give you the amount, of getting pictures, and they're actually using local artisans
Oh, wonderful.
to do that. Yeah, we try to do as much local to support the community that we absolutely can. So for sure, we're doing that. Now, the other thing I will say is that we've not, unintended consequences, our campus is a pain in the backside. If I've got an appointment in the outpatient center, well, do I go to the hospital main doors? Do I go to those doors? Oh, I have an appointment with SSM. Now, which doors do I go to? Because there's the north entrance, the south entrance. We get that. And then if I put it in my Google Maps or whatever you call it, it takes me to the back of the hospital.
Oh, yeah.
It's crazy. We're trying to fix that with signage, with font bigger than this, or bigger than that. And there's certain reasons we have to keep the address the same at all the doors. That's the government for us, Challenges, they do a good job for us, but they also struggle mightily with some things. But anyway, my point to that is we recognize some of these challenges, absolutely. But for the pictures, that's an easy fix that we're working on. So thank you for that. I thought you were going to tell me it's a pain in the butt. You showed up at the wrong door.
I figured that out, but I used to work there too.
Oh, excellent. Yes, ma'am. That's helpful. Yeah, our first time visitors sometimes struggle with the appropriate door to go to, which we're trying to fix that as well. So, anything else? I know I've taken up a lot of time, but I'm happy to answer questions or stick around for a while. I know Mayor Swadley still is going to be talking, so. Well, I really appreciate your time and attention. It was fun to talk about the two things you should never mess with people, their health care and their finances. Did I mention health care is expensive? Sorry. Anyway, thank you very much.
Thank you, Chris.
All right, it'll just take me a moment to switch this over. And you want the short version or the long version?
I already gave him the long version, sir.
All right, I'll do the short version.
Yeah.
All right, here we are. Of course, we have to start with road construction, right?
Oh, yes, always.
Which has been an ongoing, so most of
Actually,
you.
Tim, before you start, are there any other East Siders here?
Yeah.
So I just think East Siders should get a pat on the back for being patient with all the traffic that is on our side of the city right now. So just gonna say.
Yeah, that has been really challenging, not only for those that live on the east side, but the businesses and, you know, downtown businesses especially. So we're hoping to at least get the pavement wrapped up here in the next few weeks. If you've been down there, you've seen they're pouring some cement. And really, they've got most of the east side completed except for the part where we're kind of by the fire station with the infamous wall that is there. And really the issue is that the wall they had to put in like, I think it was like 32 40-foot metal beams and they had to drill them all out. And we actually gave them an early start by a few weeks to get those installed. And basically what happened is a DOT project and the subcontractor really didn't perform at the level that they were expected to. So they brought in a different team and they managed to get the rest of the beams drilled and installed. I mean, they had like 7 of them, and then within 2 weeks they had the other 25 done just by bringing in a different crew. So that's the good news. And the bad news is they still have to come back and finish the wall itself. So the beams are in there, it's supporting the wall there that's going to eventually go in, so there won't be any erosion or anything bad that'll happen. But we're trying to get the road open, and now of course we're up against the temperature deadline. Ideally, they'd like to pour cement when it's 40 degrees and rising, which they've had pretty good success the last couple weeks. Probably not going to be so much next week the way it sounds.
That's right.
And we'll see what happens after that. So they're also trying to get sidewalks and curbs and gutters in as well. And they're going to have to come back in the spring and finish the wall itself, which means that that section will be closed for several weeks again. So we're trying to coordinate that. I know Sarah and our Public Works Director, Aber, have been working really closely with the business owners. They have weekly meetings. There's an email list you can get on. I think Stoughton Health has been on those meetings as well, just so everybody has open communication. The DOT folks that are managing the project are doing the best that they can, but it's just another example where, quite honestly, the labor market is really not what we like to see it to be. You talked earlier about recruiting and retention. We're seeing that all over the place. I mean, we see it in the school district, trying to keep teachers. We see it in the healthcare industry. We see it in the labor force for the trade. We see it at the city. We're having a hard time filling police officer positions, really statewide. And this is just another example of what happens when the labor market's really not what we like it to be. But we're making good progress, and we'll get there. We just passed the budget about a week and a half ago. And just some things that we would highlight in our budget is 70% of our budget is salary and benefits, so that's our people. So what we really try to focus on is making sure that as much as we can, with the state imposed levy limits, that we retain our people. So we basically gave a 3.5% raise for our employees. We had to make a change in our health insurance provider to keep our costs down. We're looking at double-digit increase, so we had to make a change there. We had record growth 3 of the last 4 years, so that allows us to raise property taxes citywide, what the theory is you have more residents and business owners sharing that additional cost. So at the end of the day, it minimizes the individual impact for the taxpayers. So we were able to hire some positions to accommodate the growth. 2 at Public Works, 1 for the streets, 1 for the parks. With all the roads and parks that we've been putting in, you know, they need to be maintained at a level with the trails and the equipment and snow plowing and road maintenance. As well as we partner with the school district to put in the school resource officer. For the current year that we're in now, we actually received a grant to pay for the city's portion, but going forward, we had to budget for it. So we're able to budget our share for the city taxpayers' share of that. And then the school district pays the other half, which is actually also city taxpayer money as well as the township money. And then we are adding a part-time position at the library as well. The library has multiple floors, and it's really challenging there when somebody goes on break, or for safety reasons, we like to have more than 1 person on the floor in case something happens. So we've been able to position there. And then the other things that we really looked at is looking at long-term what we can do to make sure that we're in a position to sustain these positions. We don't want to go out and hire a bunch of people and then have to lay them off. And basically that's what happened in Dane County. Over the last several years, Dane County hired like 500 and some people, and a lot of those folks were new positions paid for with pandemic money, which isn't a sustainable funding source. So now they're in a position where they had this huge deficit because they didn't properly budget, in my opinion. Now, they may have other opinions. So they're in a position now where they have this structural deficit that they're trying to manage, and we're trying to avoid being in that position going forward. I'm pleased that we were able to do some other things, like we made an adjustment for our EMS. We have paid on-call volunteers, and we budgeted money out of the EMS budget, which is separate from the taxpayer-funded portion of the budget. The EMS budget is paid for by the money they collect from insurance companies or individuals for the services they provide. So we were able to adjust their budget to create more funding for those paid on-call volunteers. Many of them now come from Madison. They're UW Med students looking for experience, and they want some sort of guaranteed money. The current structure is basically when they leave the pad at the EMS building, they get $30 for a run. So sometimes they might get 10 runs a night. Other nights they might not get any. So we're going toward more of an hourly wage to give them guaranteed money. So at least if they come down and they don't have any runs, they can at least pay for their gas and encourage them to work more, because volunteerism is a struggle. And then we also were able to avoid going to referendum or having additional taxes. So I'm really pleased about that. If you look around, Sun Prairie's going to referendum right now. Fitchburg's failed last year. Madison had one last year. So most of the Dane County municipalities have either gone or are going to referendum, much like school districts, or have created, these different taxes. And to me, it's our version of the tariff. All you're doing is charging people more for services that you're providing, and it really isn't the answer. It doesn't get to the root of the problem. The root of the problem is we're too dependent on property taxes to pay for the services, whether it's the city or the school district. And the state doesn't seem to want to address that. I'll have an opportunity to talk to some folks in December. 7 mayors will be at the Greater Madison Area Chamber of Commerce, and those are the types of issues that we collectively discuss with the legislators that are there and some of the lobby groups that typically are not in support of anything that helps us raise revenue. And my point to them is basically, look, if you want us to grow and have safe communities, you have to allow us to provide the services, whether it's police or case managers or whatever. The expectation is we're going to provide the services, and the state's really not allowing us to come up with any other means of doing that. So we take advantage of those meetings to try to educate those that really don't understand what our challenges are. Another part of our budget is our capital improvement, and those are things that we borrow money for. So buildings, vehicles, expensive equipment, and those typically we borrow money 20 to 30 years, depending on what those projects might be. So we were able to do some things in there to try to create efficiencies and save money in the long run. And then to continue to invest in our community. So one of the things we were able to do is we have the project going down on the river. We expect hopefully next summerish, maybe fall, that they'll start digging out there for the apartments. And we had to basically shift some money around from the tax incremental financing district out by Walmart in order to pay for the debt that's been accumulated over the years to acquire the buildings, demo the buildings, clean up the contamination, and get that site ready to put in a stormwater pond and a road to serve the apartments. So we were able to do all that in a budget, which I'm really pleased about because that's going to expand our tax base. In our budget, we can raise our taxes, as I mentioned, by what they call net new construction. It's a formula based on growth. So if we put up $1 million house, we can raise our taxes proportionately for that, or it could be a commercial building. And then there's also an incentive in there for what they call expense restraint. So if you're a low spending municipality, which Stoughton has always been, you can take advantage of that incentive. Well, this year, instead of using that incentive for our operations, we're going to use that money for our other part, our capital improvement part of the budget, so we can still utilize that money without being penalized on the net new construction portion. And I know it's a little bit complicated, but at the end of the day, it's really going to allow us to be able to hire the positions that we desperately needed. And then this one here kind of just summarizes, and you'll see that basically on a $350,000 home, the city portion of the taxes is going to go up about $110 for the year. And you know, that ensures that we'll be able to continue to provide the services at the level you all expect and deserve. These are the new positions I mentioned, and you can see that some of the positions, when we say levy, that's the property tax. We also have a stormwater fund. So on your tax bill, there's a stormwater fee that you pay. So for some of these positions, we're eligible to charge that to those fees. And then we also get money from Dane County for the library, which I'm going to talk about in a little bit. Any questions so far? A couple other things. We do have the shared ride service, which is the taxi, so we're going to continue to operate that. And then I talked a little bit about the expense restraint program. We're going to put that money in the capital fund. And then we're going to do what we can to have a consistent amount of money that we borrow. We have like a 5-year borrowing plan. Garbage is also on our tax bill, so we contract that out, and our garbage rate with our contract is going up 2.8%. Johns has provided a nice service for us. They also do recycling, garbage, bulk pickup, e-cycling, so they do more than just pick up the garbage, and they've been really good partners over the years. EMS we talked about a little bit, so we'll continue to work on the specifics of the new pay program for the paid on-call volunteers. And then here's the library. So you can see the library between what the city budgets, which is the $711,000 a year, is the tax portion to fund the library. And then we get about another $300,000 from Dane County because we're part of the library system. So communities that don't have a library have to basically pay into the system so people can still go to wherever library they like to go to, and then they track it through how many people literally come through the library door and use the services. So basically what this says is we're investing over $1 million a year to operate our library. So when people say, oh, your taxes are high, well, we're trying to provide services that people really want to have, and the library is certainly one of them. And it's one of the anchors downtown to bring people downtown, and when they come down, they go to the coffee shop, they spend money, they go to the post office, and they do other errands. So the city's portion is over $700,000 a year. And this kind of breaks it down. I know it's hard to see, but they track where people are coming from, and and how much we get from the other communities to support our library based on the traffic flow. That's what this one is. And then the other one is the Opera House. So the city, we invest over $200,000 a year to operate the Opera House, which is basically 2 of the 3 full-time positions. And that's just for the operations. That doesn't include any costs that we might have on the building itself. And the reason we do that is because the Opera House, based on projections, generates $3.2 million a year for the city of Stoughton and the businesses that are in there. So part of my conversation when I talk to the state legislators is, well, the city is spending $200,000 a year on the Opera House. We're bringing in $3.2 million. So that $3.2 million, some of that includes like sales tax, which the state of Wisconsin gets, Dane County gets 0.5%, and then the people that work there also get, charged for income tax, which is state and federal. So the city is investing $200,000 a year to operate the Opera House, but the money that the Opera House generates doesn't come to the city. It goes to the businesses that benefit from having it, which we're glad to be able to provide that, or the tax revenue goes to the state and the county. I think that's wrong. I think that municipalities should have the opportunity to collect that money to give taxpayers property tax relief. Instead of that sales tax going to the state of Wisconsin, sitting in a bank in a surplus, that money should be given to us locally so we don't have to raise your property taxes every year. The state of Wisconsin doesn't see it that way. We believe in local control. We don't like to be micromanaged. They're on some sort of a power trip. They think they're smarter than we are. I'm here to tell you they're not. And I can give you multiple examples if you want to stay here all day. A little bit on development. So Stoughton Trailers, how many people took the tour of Stoughton Trailers? A few? What'd you think?
It's pretty funny.
It is really nice, and it's really just the beginning, which is exciting. So the headquarters is done. They're fully employed. And then the next project is the apartments here. This is all approved. They closed on the property. I think they're literally have already put a shovel in the ground. So we're excited that they're gonna build that out, and they're doing it in phases. There's gonna be 12 buildings, over 300 units altogether. And it'll probably take about a year or so for them to get all completed. And then we're still working on some of the issues that go with that. We have to get the road connected out on B, so we're working with Dane County on that. And we know we're gonna have construction on 51 next year. So we had to do some additional traffic studies to make sure that these apartments, if people start moving in here, if this isn't ready and they can't use this or this because it's under construction next year, how are people gonna get in and out of there? And fortunately, we were able to do that work and come up with an analysis that shows that the traffic on Roby will support that. So we're excited about that. And that was really one big thing we did last minute to get that project to the finish line. We worked with Continental, who are the builders of the apartments, and because they needed some assurances if they build the apartments, that their lenders want to make sure that we would allow them to be able to actually live there. And if the traffic indicators didn't support it, they weren't going to be able to get the loan. So we were able to work through that. So I'm pretty excited about that. And then the next phases will be starting. We're currently having conversations about the park. So if you go on our website into the park and rec department area where our agendas are, you can see some different examples of what that park might look like. Basically, the initial phase will focus on large fields for like soccer or lacrosse or flag football. And then there's some other amenities we'd like to have in there, like the shelter and playgrounds and things like that. And then eventually, we may have a larger conversation about some of the other amenities. The way it works is we collect money when they pull building permits for all these apartments or homes, and that's the money we use in order to pay for the park equipment and things in the park, because we don't want to borrow money for a brand new park. We have impact fees that are designed in order to cover those costs. And that was one of the things that when I took over as mayor, that I discovered that we were literally borrowing money to put in playgrounds and brand new parks, and that should not have happened. And it happened for a couple reasons. One is our impact fees were grossly low because they hadn't been updated for years, so we updated that. And that promises were made to developers that should not have been made. You can't build a new park and borrow money, and that's what was happening in our community. Now, for an existing park, you know, eventually you have to replace the equipment, that's when you borrow the money, but you shouldn't have to do that for a new park. So it's gonna be really interesting to see how far the money actually takes us, because the park itself out here is about twice as big as required. Well, we're not gonna have twice as much money for the equipment that's gonna go in there. So there's probably gonna be some sort of a fundraising campaign or something, because I don't think that we should put it on the back of the taxpayers. That's my opinion. I'm not the decision maker, but certainly we'll provide the information to the city council and they can figure out what they want to do long term. And then this is kind of the layout of what the apartments will look like. It's fairly high density. They have some amenities which we've talked about in the past. Community garden, dog park area, swimming pool. So the people that'll live there, it'll be like their own little community. A couple new businesses, where Pancake Cafe was. There's gonna be a new Mexican restaurant in there. I've been told, but I can't 100% confirm that it's an existing one, and I don't know if they're adding one or if they're moving. It's a little unclear what's going on there. Yeah, so I know they came in and talked to the clerk about the liquor license, because you can't move a liquor license from one building to another. You'd have to get an additional one, and it's $10,000 just for a liquor license. So stay tuned on that one, but I know they're over there working on it. And then over where Robert's Auto Electric was, there's a new automotive repair shop in there as well. Yeah. And then right down the road here where Giggles was, we're starting to see some movement there. And it has something to do with the Wisconsin dairy products. I'm not really that familiar with them, but it's somehow associated to like the Dairy Expo and kind of that whole world. So I'm not sure exactly what that's gonna look like in there, but they've started to decorate the windows so you can kind of peek in there and nose around a little bit, but there's really no desks or anything in there yet. But we're excited that that space is gonna be open. We worked really hard with the two guys that have been remodeling the building themselves. A lot of blood, sweat, and tears over the last couple of years. And as you can imagine, you start a project 2 years ago, and then all of a sudden the cost of everything goes up. So we really worked hard with them to figure out financially how we could help them get to the finish line. So I'm really pleased that it looks like they're gonna make it. So it's, our downtown business owners are amazing. They spend every single dollar they have and then some to try to reinvest in our buildings. And we do what we can to support them. Obviously, we have limited resources as well, but we certainly try to be creative and work with them to have a thriving downtown, and certainly our investment in things like the Opera House, some of the other things that we're gonna be doing at Mann Park, which I'll show you, also helps encourage people to come downtown. The car wash is open. We had a ribbon cutting the other day. That was pretty exciting. I used to be in that business, so I was kind of geeking out at the technology there and how it's changed. Big water users, Stoughton Utilities is really excited. But they also reuse some of the water. So the newer systems, they do reclaiming the water so they can use a certain percentage of it over and over again. So we're excited about that. So I think they had a pretty successful grand opening, and you can get in and out of there pretty quickly, so it'll be interesting to see what happens after the snowfall and everybody gets salt on their cars, because they can do well over 1,000 cars a day. Yeah.
I got a free car wash and it was excellent.
It was
Yeah.
very nice.
First day,
First day?
yeah.
How long did you wait?
5 minutes.
Wow.
It was early in the day and I was going to get a car wash at Quick Trip.
Yeah.
And here's a guy out there with a sign saying,
Yeah.
free car wash.
Come over here.
It's kind of hard to turn that down.
Right, right.
Yeah. So, yeah, I used to be in that business. They have one down in Janesville, which was a different company back then. It used to be the Wonder Wash, and I used to manage that one back when I was younger, and I was in much better physical shape. Because we used to dry the cars, so we were on our feet all day long, and we were wet, and back then I had a mustache, and it would be frozen. My lights would be frozen.
We'll see if we can
And
picture this.
as wet and cold as I always was, I never got sick. My immune system was great. But it was a fun business, you know. I mean, surprisingly, there's a lot of maintenance, a lot of moving parts, a lot of grit and dirt, wearing metal out, and a lot of pumps and motors. It's pretty cool there. The technology's great, so we're excited for them. And I think there's only like one commercial lot left in the whole development out there. Here's some work we're doing on the river. You can kind of see Matt Park in the background. And you can see what they're doing is they're putting in a trail here where the road was. There is a ramp here, so there's ADA accessibility, some steps going down, some rocks there. And you can even see, even with the preliminary work they've done, how it's creating the ripples in the river, which is what we're trying to do for people that want to canoe or kayak. And then we're still working on some other permits with the DNR, but working with the DNR is like moving glaciers, so we'll see how that goes. But we'll eventually get to a project, a point in the process here on these downstream portion. Well, there'll be a public hearing and people can come out and voice their thoughts and concerns about the project. But you can see the riverbank is you know, looking a lot better, and then we're going to have better drainage as well, which is really important for Man Park. And we're doing some additional work down at Man Park. We did some last year, and then we're going to do some additional work behind, over by Troll Beach to have better drainage over there, because it gets extremely wet there. So we're working on putting together bids for that. So there's multiple things that are going on here. There's this riverbank project. There's 2 permits that we applied for with the DNR in the river. There's a project that we'll probably do by Troll Beach. There's apartments that the redevelopment authority will be working on, the River Haven, which hopefully will start next year. And then eventually there'll probably be a conversation about the dam, and we'll see what the DNR decides. You know, at the end of the day, it's going to be their decision based on all the information that everyone provides them, and we'll see how it goes. But regardless, this is going to be really nice here because we're beautifying the river. There's going to be trails to the bridge, and there's going to be a trail going underneath 4th Street so people can cross 4th Street safely. And overall, I just think it's going to draw people down there. I know Taste of Stoughton is already talking about moving their event down there next year because we'll have more green space. We have the grandstands and parking. There's like 217 parking spots down there right now. We're working with Dane County to secure a grant for 4 EV charging stations. So we're hoping that'll happen. So there's a lot of activity going on at Man Park right now. Stoughton Choir and City Band's coming up at the Opera House. Anybody ever been to that? It's pretty impressive. They do a really good job. So that's coming up here just in a couple weeks. And you know, the Opera House has been wrapping up the stuff that John Boydell does with the Monday afternoon music appreciation series. And the Opera House is in full swing, so I encourage you to go to a show. And that's all I have, unless you want to talk about road construction, but yeah. Do you have a question?
Yes, I saw in the paper that came out of the Hub yesterday that Williams Drive land negotiations are in a 27-acre parcel on Williams Drive. And is that going to be some type of Public Works, what are you thinking is gonna happen there, and where's the money coming from?
So out on Williams Drive, so picture Highway B in Williams Drive, there's the church on the corner there.
Yes.
So if you go down Williams Drive, kind of going toward Ortega, there's 2 lots in the farm field there that the Moe family owns. It's the last 2 lots that they own. The rest of the lots they sold to Emmy Roth. So last year in the budget, we had budgeted money to explore an opportunity long-term of potentially building a new public safety building. So putting police, fire, EMS all in one building. And really trying to locate it in a part of town where it's not as heavily congested, because getting out of the downtown is a real challenge, especially for fire and EMS. And then repurposing those buildings downtown, I think may be advantageous, whether it's commercial or housing, we'll see. Probably several years away from that. So that's kind of how the conversation started, is if we were gonna build a new public safety building, where would we build it? So what we did is we hired some part-time people, temporary positions with pandemic money to do electronic mapping. So we had them do a heat map, and basically what they do is they took all the calls that came in for fire and EMS, and then they took all the residents that are volunteers, and they put dots on a map, and based on that, it was determined that this land here would be ideal for a new public safety building someday. Now, that doesn't mean that's what we're gonna do there, but as part of the process, we've been designing a building that would basically fit there. There's other options. So you've heard me talk to you in the past about the Stoughton Utilities building. So the Yahara Bay Distillery is still interested. They're probably a couple, 3 years away. They've been down there almost once a week with their engineers figuring out, okay, when they acquire the building, what is their phasing gonna look like to get their production in, and eventually a tap room and all that. So Stoughton Utilities needs a new building sooner than later. And they have money in their budget. They have their own team that are working on site selection right now. We're hoping in the next month or so, they'll narrow it down. That location potentially could have a Stoughton Utilities building. They also have some land out on 138 toward Oregon, across from Walmart where the utility substation is. They own that land. There's pros and cons to it. That land is probably worth more because it's ideal for commercial visibility from highly traffic, high traffic highway. This land here, it's farmland, it's not as expensive. But basically, to answer your question, we'll be borrowing the money. So when we went through the capital improvement budget, all the department heads submitted in their budget requests, and we came up with a number with the city council agreed to. Our financial consultants, Ellers, that we work with, said that number fit within our 5-year spending plan. And then I went through and I basically scrubbed it and said, we don't really need this. This can wait 3 years. This is more of a want than a need. So we're able to reduce the amount we're gonna borrow to cover the cost of purchasing this land. So this land could either be used for a public safety building and or a utilities building, or if somebody came up tomorrow and said, hey, I wanna put up a building and I can bring you 200 jobs, we would seriously consider expanding the business park there. All the utilities are there, so we feel like we have flexibility. I believe that the city council is gonna approve it Tuesday night, we'll see. I'm not the decision maker, but based on our negotiations and the conversations that we have, I'm pretty confident that they'll approve it. And then we'll probably wait and see what happens with the utility study for site selection, and then move on from there.
What address will you give it?
I don't know yet.
Hopefully not 1805 or
No,
whatever.
we'll certainly take a closer look at that.
Please. Please.
It's kind of an inside, I don't even want to call it a joke, because
It's not a joke, they're still driving through.
Yeah, so we definitely, we'll be having that conversation, and even going forward, working closer with the county. The issue is the address grid that we have doesn't perfectly align with the address grid that Dane County has, so we ran into a conflict with Emmy Roth, and it's really difficult to get somebody to change their address. We can change the road name, but to change somebody's address, it's up to the property owner to do that. So it's been a thing. Yes, sir.
I got 3 questions, all have to do with Dan Park.
Yep.
Long time ago, when I was in the military, took an officer training course, and it says, keep moving ahead, but keep the troops informed. Now, Man Park seems like you're moving ahead, but I think there's very little effort to keep the troops informed. There was initially quite a bit, but lately, there's been last year or so, very little. You had a letter here a couple months ago that explained some of the things.
Mm-hmm.
Now, I'd like to give examples. When we were lining up for the Memorial Day parade, we had the veterans float parked right out there and talking about things, and one of the guys said that's a lot of cement. That led to what's ever going to happen out here? What are they going to do to recoup some of this revenue? Nobody knew. A lot of the I thinks or I heard, which is contradicted by another person saying, well, I heard this, and nothing concrete. Since that time, I've spoken to 3 separate smaller groups, and the response is always the same. From that, I have generated 3 questions. And number 1, how much money has been spent so far?
At Man Park?
At Man Park. I got 3.
Okay. I'd have to go back and look collectively.
I'll give you a ballpark.
You'll give me a ballpark?
Ballpark figure.
Depends on which segment you're talking about. So we spent probably, I'm gonna say about $2 million between moving the grandstand and then redoing the area around the grandstand and the parking lot. And then we're probably gonna spend about that much on the river portion of it right now. And then we had previously spent some money on the bridge and some riverbank work. Now, some of that was offset by grant money, but not all of it. So I'd have to go down and get the breakdown, which I can get. I mean, but it's a several $1 million project. We also, it's like our second largest park. And quite honestly, we haven't invested any money into it for decades, and it showed it. And the idea is to use that park is more of a destination park for larger events. So in the past, we've had things like, coffee break. I mentioned earlier they want to move the Taste of Stoughton down there. Right now it's in the neighborhood park. It should be in a community park. And then we want people to utilize the river and bring people to the downtown, which should support our businesses. But there again, the taxpayers are spending all the money to do the repairs, and then any money that's generated goes to the state of Wisconsin. And that's kind of one of my complaints with the state of Wisconsin is, how in the heck do you guys expect us to continue to invest in our communities if you guys are taking all the revenue that we're creating, especially in Dane County? Because Dane County is growing, and 30% of the entire statewide growth is happening in Dane County. And it's because other communities like Stoughton are investing money in their parks and their trails and the old buildings and the Opera House to get people to want to live and work here. So, but I can get an exact number. I just
I don't care about the exact.
I would say several $1 million, probably at this point, I would guess 5 between the different components, but there's like contamination down there, that's part of it, that needed to be done regardless of what we did. You can't just leave it there.
Second question, what were the benefits of moving the grandstand? How do citizens of Stoughton benefit from that?
The benefit of moving the grandstand was to create more green space and have better traffic flow, more parking, safer. So if you go down there and look, before it was kind of cockeyed because it was set up initially, they had I played softball there back in the 80s. And even the tractor pole wasn't running parallel with the grandstand. So by moving it, which I want to say that was, I'm going to guess $100,000 or so to move it. What that did is it created more parallel, straight line entrance and exit points, and then it created a lot more parking down there. So when they want to have a hockey tournament, it's a much more attractive place for the Mann Center to have people come where parking is readily available. It was kind of a mess down there. You had a fire hydrant right in the middle of the parking lot. The parking lot itself needed to be replaced anyway because it was old and dated. Plus the drainage was terrible because it was a dump down there. So a lot of the cost for that, you don't really even see because that was stuff that was in the ground that they fixed while they were doing it to improve the drainage so it doesn't flood down there.
Now that's what you need. What are the long-range plans to recoup the financial expense? That's our firm plan, not just that whole. The plans to recoup, how are you gonna get some money back from the work you've done down there?
The idea is to get more people to want to come and live in Stoughton and build a house and eventually either live here or come here and spend money at the businesses. That money, like I said, doesn't necessarily come to the city, but it makes our city a destination place, which is good for our local community. It provides jobs for people that work here.
Okay, thank you.
But thanks for the questions. I know it's expensive. There's no denying that. But it's also, in my opinion, been neglected for way too long. And that's one of the things when I ran for mayor the first time and the second time, that we said we're gonna invest in our community. You can see what's happening. We're growing, which is good for the school district. It's good for Stoughton Hospital. I mean, that's one of the reasons why they invested $25 million is because they know people are coming to live here now because the city is committed to investing into our community, so that all adds up. So it's not just the city, it's collectively, we're all investing money to make our community safer and better and more services so we don't have to drive to Madison every time we need something.
Thank you.
Thank you, appreciate you staying late.
Us older people aren't gonna be able to stay in our homes.
What's that?
We aren't gonna be able to stay in our homes. The older
That's
people.
definitely a concern, you know, so that's why we put together, you know, the 5-year plan with our financial consultants. And what we need to do